Hi everybody, welcome back. I hope you had a bit of a break because we have probably quite a hectic afternoon ahead of us. We'll be moving between breakout groups and plenary. So let me just explain. We're going to work together to finalise and hopefully agree on what goes on the ballot paper in April on the very important set of issues regarding care. And I just want to recall the process that we followed so far. So we drafted a first set of recommendations based on the feedback and the notes from your breakout group discussions and your reflection surveys. We sent them to you, and I'm very grateful that you responded in large numbers, giving us your feedback on that first draft. So we then took account of that feedback. We revised the ballot paper and we sent you a second version, a revised version, on the 5th of March. I hope you had time to look at the video that I made explaining where and why we proposed to adjust the draft to take your comments on board. And I hope that the slides accompanying the video showed you exactly what changes had been made. So what you should concentrate on today is the draft ballot paper that you received in the meeting pack, and it's also built into the agenda for the meeting. As you know, today you're not voting on the recommendations, but you will be deciding, we hope, on what will be on the ballot paper next month. So for this afternoon, we're going to divide the discussion on the ballot paper into 3 sections. First, you will have 35 minutes to discuss the 4 recommendations on carers. Then you'll come back to plenary and we'll hear whether there are any questions or suggestions for changes to the wording. The RUMAX facilitator will communicate these on behalf of your group. If we do need to change the wording, we'll do a quick Zoom poll. And once we have agreed on the wording, we'll then do a series of Zoom polls on each of the options to appear on the ballot paper. Then I hope that we'll be able to stick roughly to the timing in the agenda. So around 2:10, we'll move on to the 2 questions on childcare. And we follow the same process I've just outlined. And depending on the timing of all of this, I hope we'll be able to take a comfort break around 2:30. Lastly, we'll cover the 3 questions. Remember, these are on older people and persons with disability, and that will be about 3 o'clock. One thing that I feel worked well in our February meeting was that you were able to ask questions directly from the breakout groups. And where we were able to answer the questions immediately back to you in the groups, I think that helped your discussions. So we do have some experts on hand today to help us get replies quickly to you. Like last time, if you have questions, your questions will be sent to us by email by the question recorder in your group. And where we see the same question coming up in several groups, then we may decide to answer them in the plenary session so that everybody's aware of the question and the answer. So I hope that this will work as well as last time. So since time is very precious today and we want you to have the maximum amount of time to discuss with one another, we're going to move you into the breakout groups now, and we'll bring you back around 2:20 and hear your reactions to the first group of questions on the carers. Thanks a lot and see you in a little while. We see a lot of the same question coming up in different groups, so I thought it was easiest to try and answer your questions collectively, then everybody hears the same answer at the same time. And it's not surprising that there are questions because this whole area is quite a complicated set of social welfare payments and tax credits and training and all the rest of it. So the kind of questions that are being repeated in different groups are, first of all, what does the word disregard mean? Income disregard. That means the limit below which people's earnings are not affected. Or it's, as somebody put it in one of the questions, is it a kind of a means test? And yes, it is. Is training, access to training and professional registration completely funded, subsidized, or at the expense of the individual? We haven't specified that. What we're calling for is that carers should have access to all these accredited programs. In some cases, their company may pay for it. In some cases, they may contribute themselves, or in some cases, the state may fund their access to the training program. It depends on what it is. Then we have the question about the question 1A, clarification in relation to the pay structure and benefits. Do these apply to both public and private sector employees? essentially what we're trying to do here is to align those who currently work in the private sector with the pay and conditions of those in the public sector. There's also a question about what is in place for recipients of the carers allowance at the moment. Are they getting any credits or stamps? Claire from the ESRI, can I ask you to reply to that question, please?
Sure, yeah. So basically, while people are in receipt of carers allowance, they do get what we call credited stamps, which means that when they come to, say, retirement age, they would, the years they were caring would go towards their pension entitlement.
And the word individualized, what does that mean?
Just remind me the context there.
It's in the recommendation. Hold on a moment. The state should develop an individualized pension solution for carers to ensure they have an adequate income once they reach retirement age. That means anybody over 65 should be getting a personal pension.
Yes,
which doesn't depend on their marital status.
Exactly. So if you were over 65 and say your partner, your husband or wife was entitled to the pension, rather than you getting something under their pension, which would be lower, you'd be entitled to a full pension in your own right.
Yeah. Okay, thank you. Now, question 3, does it refer to people who are on carers allowance, or is it referring to paid carers? The state should, this is again the pension solution for carers. Well, this means paid carers.
No, this is for paid carers under 1, and this is for other carers.
Okay. 3. Sorry, correction. So recommendation 1 is about paid carers. Recommendation 3 would be about people who are not normally classified as paid carers. So others who do caring, but who should now get a pension in the future who don't get it at the moment. Then we have, what is the level of support grant mentioned in question 4? That is the carer support grant. I think it's 1,800 euro at the moment. And if carers get respite, is it still a procedure that the respite receiver cannot leave the house, and why? Again, we are not entering into the detail on that, but we are making the point that, that the respite care should provide access to a range of respite services to meet individual needs. So if the person needs to leave the house, it should cover that kind of thing. But that will be the detail for the government to put in later. The question of what costs on caring are covered and what is reimbursed. Ursula, are you going to answer that one? Can you unmute yourself, please, Ursula? Ursula, you're still muted.
And can I go back to one other question? The care support grant, that's what used to be a respite grant. That's only 1,700 euros. It's not, I think we said
1,800, yeah, okay.
1,700 euros at the present time, since June 2020. So, and what was the other question you wanted to ask?
About the cost, no. The costs for caring, what is reimbursed?
What we're suggesting is that costs, there are additional costs that are attached to caring. For example, if you're caring for somebody with a disability, you might have additional heating costs because of the conditions of the disability. And there could be additional transport costs. So we're looking at the additional costs associated with care in this kind of context. And we're suggesting heating and transport costs in particular as an example.
Thank you very much, Ursula. Then another question, can carers be included in professional registration alongside nursing? I think that would also depend on the course that they are doing. Some courses would lead to professional accreditation, some shorter ones would not. So again, we can't cover every eventuality here, but we're just making the general recommendation that anybody who's working as a carer should be able to do training and get the professional qualifications that go with whatever training they do. Now, excuse me a moment while I just check that we haven't missed out any questions. You'll have to bear with us a little bit this afternoon because we're trying to do things in real time. So just give me 2 minutes, please. Okay, we're back again. We have the next question, and maybe I think Ursula or Claire may be the ones to answer this. Citizens are wondering about the difference between contributory and non-contributory pensions. What are the consequences and difference in payment for single people or married people?
The contributory pension is paid at a higher rate than the non-contributory pension. There's a difference of about €28 per week at the moment. The thing about it is we have discussed this in relation to carers, but we've also discussed it in relation to welfare generally. And that's going to come up in the April
next time, yes.
But we were looking at maybe not having a distinction between contributory and non-contributory, because a lot of the submissions raise that. And so we're looking at maybe a universal pension entitlement that would be funded at the same level for every individual that reaches the age of 65, whether they've been a carer or whether they've been paid employment or whatever their circumstances has been. The state pension would be a universal pension in that situation.
And the difference between payment for single people or married person?
At the moment, in a household-based pension, it's paid at 1.7. So you get a full pension and then a pension for a dependent adult. So, and that's 1.7 in total. So you get 100% and then a 70% pension. That makes the household.
If you're a married person, and in most cases the person would be the woman, she gets 0.7 of the pension.
Yes,
in addition to the 1% in the house, yeah. Okay.
Yeah.
This is a very specific question. Currently the system will not allow a person to claim both the widow's benefit and sick benefit simultaneously. They can claim only one. Why is this? It seems very unfair.
I don't think that comes within the scope of the assembly. Because it's going down another road of other forms of welfare payments. I'm sure there is unfairness in that, but I don't think it's something we've particularly explored in this assembly.
Okay. Then there was a suggestion to change the word adequate in question 4B, providing adequate access to a range of respite services to meet individual needs. What we meant by the word adequate there was that at the moment people can get an amount of money once a year, but that may not give them sufficient to be able to leave the house, to come back to the previous question, if they're not able to pay for alternative care for the person whom they are caring for. So by adequate, we wanted to provide for whatever the person needing respite needed. And I don't know what we would change it to, but that's something I can't explain beyond that.
I think that adequate is used in other legislation and in other policy structures in the system at the moment.
So it's a recognizable word.
A recognizable term to use.
Okay, okay. Let me just check the chat line.
There is a suggestion somewhere to have costs that are legitimate costs.
Yes, but I don't think the state would.
I think use reasonable and adequate. Those are both familiar terms.
Okay, so it was interesting to see that there were quite a few questions, the same question coming from different groups. And as I said, this is a very complex area, so I don't think we're ever going to be able to answer all the questions and all the possibilities that arise. And as I think we have discussed several times, we need to make recommendations that tell the state where you want to see change, but we are not writing either tax or social welfare legislation. So there will be a point when we can't be spelling out the details too much. Now, I'd like to get a sense of your mood now, whether in the light of the answers that we've been able to give quickly, whether that is enough for you or not. So we're going to take a quick Zoom poll now, and I'm going to ask you to answer yes or no to the following question. The question is, are you ready to vote now? So are you happy in the light of the explanations to vote, to take the poll on questions 1 to 4, or do you want to discuss a bit more, in which case we will put you back into the breakout groups for another 10 minutes and then come back and ask you if you're ready to vote. So the poll will pop up now. And if you don't feel comfortable about voting now, then you should answer no. But if you feel that the answers have been enough and that you are happy to vote on the ballot that's proposed to you, then click yes. So take your time and click submit when you're clear that you've clicked the right box, because once you click submit, you can't change your vote. So take a few minutes to think about it, and that way we'll get the mood of the meeting, and then we'll follow up whichever is the majority view. Okay, so I think everybody who wants to vote has had a chance to vote. We have 90 people voting. And if we can put the poll results up on the screen, please, Darren. Okay, so we have 87% want to vote now, 13% no. That's 78 people in favor of yes and 12 in favor of no. So we will now go ahead with the vote. So one thing I just want to mention before we actually vote, and this is just a technical thing, we can only take 25 Zoom polls in any meeting. So for this reason, as we go through the afternoon, sometimes where there's only one option and the questions are straightforward, we might put two together in order that we can save some Zoom polls to do what we've just done now, which is to ask you whether you're ready to vote or not, or whether you need more time for discussion. But we're now going to go ahead to the poll on questions 1A and 1B. Each time we want to make sure that we can put the whole text up on the screen. So that's how we're going to be grouping certain things together. It will come up on the screen now in a moment. And remember, again, you're not being asked to vote now. You're being asked to decide that these are the questions that will be on the ballot paper. So now you can see questions 1A and 1B. Just take the time again now in the light of the discussion and the answers to make sure that you're clear. And then I will ask Darren to put up the poll in just a moment. Okay, Darren, I think we're now ready for the poll. So you'll hear me say this a lot this afternoon and in our next meeting. So you're being asked to vote yes or no to put these questions on the ballot paper. Take your time, make sure you've clicked the right box for your opinion, and then click submit. And remember, you can't change once you have clicked submit. Okay, so I think we have 90 people have voted again. So Darren, can you give us the results, please? Okay, so we have for question 1A, we have, okay, thanks. We have 91% in favor, 9% no. That translates in terms of number of people of 82 people have voted yes and 8 people voted no. On the second question, we have 93% in favor and 7% against, and that translates into 84 people in favor and 6 people against. Okay, that's very clear. Thank you very much. So we now have those two questions, excuse me, those two questions are clear, and we will move on now to questions 2. Sorry, I'm getting confused here. Are we going on to question 2? Yeah. So now we're going to move on to question 2, which has 4 parts. So we have 2A, 2B, 2C, and 2D. And to make it more user-friendly, we're going to use a separate poll for each part. So, Lena, could you put up the wording of question 2A, please? This is short, and several of you had questions about the level of income disregard, but it means the maximum limit that you can earn, a sort of means test in other language. Okay, so could we go to the poll now, please, Darren? Okay, so same format every time. Take your time to click yes or no, depending on what your position is. And then when you're sure you've clicked the right box for your position, click submit, please. Okay, so I think we have all 90 people have voted. So can we see the results, please, Darren? 86, thanks. Okay, so we have 96% in favor, 4% against. That's 86 people voting yes and 4 people voting no. Okay, so that's question 2A. Now we're going to come to question 2B. Again, Lena, can you put that up on the screen, please? Okay, again, a short question. Do you agree that this should be included on the ballot paper? Okay, can we take the poll now, please, Darren? And again, just be sure that your vote is correctly appearing before you click submit. Okay, thank you, Darren. Can we see the results, please? Okay, so here on this one, we have 93% in favor, 7 against. That's 84 people voting yes and 6 voting no. Okay, then we come to question 2C. Relating to reform of the carers allowance. Okay, and can we go to the poll now, please, Darren? Okay, so we now have 90 votes in. Darren, can you show us the results, please? 80 and 10, okay, thanks. So here we have 89% in agreement, 11% voting no. That means 80 people voted yes and 10 people voted no. Thank you very much. And then we'll come to question 2D, please, Lena, if you can put it up on the screen. So this is the one about access to state employment and training programs. Okay, Darren, can we go to the poll now, please? Okay, so we have all the results in from the 90 people voting. And Darren, if you can put the results up, please. Thank you. So this time we have 91% in favor of yes, 9% in favor of no. That means 82 people voting yes and 8 people voting no. Okay, that's question 2. Now we come to question 3, please. Lena, if you could put it up on the screen. Here we have explained that individualized means that the pension would go directly to the person qualifying for it. So anybody over 65 would get their own pension. Darren, can we have the poll now, please? Okay, so here we have 96% in favor, 4% against. That's 86 people in favor and 4 people against. Now we come to question 4. Lena, if you could put up the slide on question 4, please. 4A, first of all. Okay, and now Darren, if we could move to the poll, please. So again, voting yes or no, and just make sure before you click submit. Okay, we have 89 people have registered their opinion. There's 1 person outstanding. And just give another few seconds in case if you're having problems connecting or something. But if not, then I'll take it that 1 person doesn't want to vote on this. Okay, so I'm going to take it that 1 person is either absent or isn't voting on this. So Darren, can you show us the results, please? So on this, we have 90% in favor and 10% against, and that translates, obviously, if you're good at maths, at 80 people in favor and 9 against. Thanks. Thank you. Then we'll come on to question 4B. This is on the question of respite services. Okay, Darren, can we come to the poll, please? So you'd be sick of hearing me say, just check your answers before you click submit, but it's important that you can't reverse your vote. So please do. Make sure you're sure before you press submit. Thank you very much. So 92% in favor, 8% against. That translates at 83 people in favor and 7 against. So that completes questions 1 to 4. Now, I can see from the chat function that some people are asking, can we adjust the questions, etc. That's why I asked you to vote on whether you were ready to vote or not. I fully understand that some people would like to refine the wording, that you might have more questions, but I need to sense the mood of the majority and to go with that of the majority. If you want to propose changed wording, you need to come very quickly and clearly with that. And then we'll have to put that to a Zoom poll to see whether other people are willing to change the wording or not. I know it's a lot to get our heads around, but I think that despite the refinements that 1 or 2 groups would have liked to bring in, I think that the wording of the recommendations is clear and will allow those to whom it's addressed, so our public representatives, to understand what the Assembly wants to achieve, and we will not be able to write in all the details anyway. So I hope it's following the majority is the right outcome. We're going to put you back to your breakout groups now for 20 minutes to discuss the 2 questions on childcare. So that's questions 5 and 6. And as before, if you have any factual questions, please email us. And if you want to adjust the wording, also please email us, and then we'll try and find ways of discussing that when we see you again in 20 minutes' time. Okay, welcome back, everybody. Now, before we start looking at questions 5 and 6, I'm picking up a certain amount of unhappiness about questions 1 to 4, that some people feel we should have adjusted the wording. I don't think that's the majority view, but you know how keen I am on ownership of this by the whole Assembly, so I'm sensitive to that. And what I want to suggest is the following. I'd like to focus now on questions 5 and 6. We have had some suggestions for changes in wording, which I will put to you in a Zoom poll, and you can decide each time whether you want to take on board the wording changes that have been suggested by the different breakout groups, and I'll explain what they are in a moment. We also have some questions which I think it would be interesting for everybody here to hear the answers to. So we'll ask our experts to come in on that. And then I would like, once we have decided that we are going to change the wording to questions 5 and 6, or we're not going to change the wording to questions 5 and 6, I'd like to take the polls on those questions and then move on to the last ones. At the end of it, so when we've dealt with question 9, in the light of the fact that I am picking up this unhappiness, I'm going to ask you one final time if you are happy with the wording of questions 1 to 4, or if you want to revisit them. And if you want to revisit them, we will take them at the beginning of our April session. Now, one thing I want you to bear in mind is that you can see that today, dealing with a lot of different subjects, and a lot of subjects on which I certainly don't have the expertise, and some of you have some expertise, but many don't, that we're now getting into, complicated areas where we have to find a balance between sending a general message back to the Oireachtas or wanting to get into the detail. And, I'm here to facilitate what you want. So that is up to you. But bear in mind that it will take a lot more time to go forwards and backwards with different issues. So what I'm saying is already for the April session, that we will need the 2 days, and we will need the 2 full days by my estimation to be able to have enough breakout groups, plenary sessions, adjusting wording, etc. All of which we're quite happy to do because that's what we're here for. So we have a number of suggested changes, which I'm going to come to in a moment. Just give me, and as I said, please bear with me because I'm getting requests and advice from all kinds of quarters. So if you just give me 1 minute, please, I'll come back to you straight away. Okay, sorry for keeping you waiting, everybody. I'm afraid there'll be a bit more of this from now on because we have to work out how to put the questions to you so that you can tell us what you want. That might seem very simple, but it's not actually that simple. So there were a couple of questions, first of all, that came in, and I'm going to ask our experts to answer them. There were a couple of wording changes, which I will take you through in a moment. And before we go to the poll, I will then ask very quickly each room facilitator to tell us whether there was anything else relating to questions 5 and 6, and we're only going to be on questions 5 and 6 for the moment. If there was anything else on that I haven't mentioned that people want to have answered before we move to getting your opinions. So there were 2 questions that I've picked up so far. One was on the non-transferable parental leave. So maybe Ursula, are you going to be the expert who will clarify that?
There was 2 issues that were questions that rose on that. The first was about non-transferable. Non-transferable is a principle that's established at European Union level on the directive of parental leave, and that's translated into national law in different countries. And it really refers to the idea that we want to encourage sharing between parents. For example, a woman has access to a certain amount of leave, and a man also. But the men's leave can't be transferred to the woman. It's only embedded in him. So it's about trying to encourage the sharing of parental leave between all the involved parents. The other question that was asked about whether we should have the level of parental leave and maternity leave and other kinds of payments, whether they should be linked to a person's salary. Reflecting on your views, we felt that it was better to look for an increased payment level that would apply to everyone, rather than some people getting higher parental leave because they were on a higher salary and others getting lower payments because they were on a lower salary level. So we were looking for an increase of the rate across the board, which would be an inclusive approach. And we thought that reflected your views.
Thanks very much, Ursula. And then the second one was a question asking us to clarify publicly funded. Does this mean publicly run? And there was a suggestion then to change the wording to publicly funded, publicly run and regulated model. And I think, Helen, you're going to explain what these different concepts mean, please.
Yes, so the issue is really, we think that it's the public funding and public regulation that are the key things here. In most systems across Europe, they have a variety of providers, so it's not 100% public run in any country. So you can have community providers, for example, or sometimes there's like parent-led centres. So there's the key thing here is that it's around the funding that's publicly provided, and we're a very long way. You know, there would have to be a massive shift in terms of provision if the system would simply not be capable of shifting from the system we have now to one where it was provided fully by the public sector. So the idea with this statement as well is that it's a move towards a publicly funded system. So this is to happen over the next decade. Somebody also asked, or one group asked, whether this meant would it be totally public publicly funded. So again, this is something that even in the the Scandinavian systems, there's very often a parent contribution, and that would be very much subsidized, and it would be linked to people's earnings. So it's as I say, the way it's stated here is that we will move towards a publicly funded model, but that's not expected to happen overnight. And the regulation, I think by default, that is the meaning of that, is that it's publicly regulated as well.
Okay, thank you. So we had some suggestions for changes in wording. We'll put them up on the screen in a moment, but just to mention them quickly. First of all, in 5A, there was a suggestion that we would add the word accessible. So we would talk about moving over the next decade to a publicly funded, accessible and regulated model of childcare. And secondly, then in question 5B, where we're talking about the percentage of GDP, to increase it from the current 0.37% of GDP to at least 1% by 2030. And instead of saying by 2030, to say by no later than 2030. So what I'm going to propose again in a couple of minutes is that we will poll you on whether you want the original text that we sent you on questions 5A and 5B, or whether you want to revise them in line with the suggestions that have come from some of the groups. So we'll take a poll on that in just a moment. But I just want to check with the facilitators from each group. We've answered a couple of questions, and I'm proposing to take 3 of the wording changes that have come from individual groups and see does the majority agree with them or not. Can I just ask the facilitators from each group very quickly, and focusing only on questions 5 and 6, to tell me, was there anything else that needs to be clarified? So can we have a facilitator from group 1, please?
Thank you, Chair. You've addressed the proposed amendments that came through from the citizens in room 1, and other questions were answered via the recorder. So
thank you very much. Group 2.
Yes, thank you, Chair. We've submitted the questions, and thank you.
Thank you. Did you get answers to them?
We have been getting answers back.
Okay, that's fine. Thank you. Group 3.
Yes, one question has been answered. One citizen suggested that it had been suggested in the documents they received that the current problem was that childcare at the moment was over-regulated and that there was a duplication of regulation. And so he just felt that he wanted clarification on why a regulated model was included in this. And then in respect of both 5A and B, they refer to goals for the next decade. Would it be possible to include both short-term and long-term goals? So they're the issues that arose. Thank
you. Group 3, Group 4.
Oh, thank you, Catherine. The questions were answered for Group 4. Just to reiterate, the question around decade was brought up by one person in the group, and whether it could be slightly shorter, and the wording for non-transferable. Just one or two people in the room in room 4 thought that maybe that was forcing people to take leave.
Okay, I'm going to ask our experts to come back in on some of these questions that don't appear to have been fully answered. Okay, Group 5, please.
Yeah, thank you. Group 5, we discussed the issues, a lot of the issues that were raised there, and we ended up being happy with the wording of the questions as stated. So
thank you.
Fine.
Thank you. Group 6.
This is fine, thank you.
Thank you. We had a query over the word publicly funded, but we sent the query off, but you seem to have answered that. But there was also maybe a change in the wording of the question itself. Move over the next decade to a combined private and public funded and state regulated model. They just wanted to change the wording of that a bit, and we've sent you that. So thank you.
Thank you. Question 7, Group 7.
Thank you, Chair. There was a few questions and comments from Group 7. First, in question 5, the comment was that to move forward with a structured timelines and targets over the next decade. For example, not to sit on it for 9 years and then be looking to implement it by year 10. So it should be fully implemented by year 10. On question 6, a question arose in relation to this question, as in A, it specified that it related to the first 12 months of a child's life, but it wasn't clear to some members of the group whether all of the different proposals in the different sections of question 6 all related only to the first 12 months of the child's life as well. In relation to subsection C of question 6, it also wasn't clear to some members of the group whether lone parents would receive the same, in lone parents receiving the same total leave, is this that they would receive essentially twice the leave of what one person would get in a married family or a cohabitation, and in that case, what exactly is the definition of a lone parent? I think to some it seemed like that this perhaps shouldn't be included, because that in itself might be unequal if it was proposed to give some people twice as much leave. And then I suppose I think that's about it for the questions. There were some additional comments, but yeah, I think that in relation to section D, there were some that said that it wasn't clear what it meant, and what they wanted was a guarantee that their position can't be changed and that they'd be reinstated, and that there'd be an option to vote for that.
Thank you. Group 8, please.
Good afternoon, Chair. Most of the queries have been addressed. However, the only one left would be 6A, where it says covered the first year of a child's life. They would like or adoption to be added to that, because it doesn't seem to take into consideration an adopted child.
Okay, and thank you. Group 9.
Thank you. Most of the points were covered. Just again, in relation to question 5A, the members of room 9 were keen to see that it was more target date specific. So over the next decade become something more, for example, with the by 2030 measure on B. And then there was just a general query in relation to 6D in terms of increasing payment levels. A number of members were wondering, will these be state funded, or would it be private companies expected to fund this themselves, or would it be a shared burden of responsibility?
Okay, thank you very much. Can I ask our experts now to come in and clarify those various points? Helen, can we start with you this time?
There was a question about the regulation and why we have regulation in there. I think regulation is really important in terms of quality of care, so we wouldn't want to take that out. But there was some discussion when during this session on childcare about there being too many inspections, from education and health and whatever. But I think in discussing that, we felt that was too much detail to go into in terms of a recommendation. So I think that was why we didn't specify that anymore in any more detail there.
Sorry, Helen, did you cover the question of adopted children? I think they are covered in the legislation, so we wouldn't need to explain it here, but I'm not sure if did you cover that?
No, I didn't. No, I thought Ursula might be doing that, but I mean,
okay.
That was a wording question change. Yeah.
Yeah. Ursula then, please.
Yeah. All of the legislation covers adopted children in Ireland. All of the leave for parents covers adopted children as well. So we didn't feel we needed to specify that. In terms of covering the first year of a child's life, in terms of 6A, paid leave should cover the first year of a child's life. That doesn't apply to all of the different leave systems. For example, parental leave can be taken at any time up to the child at age of 8. So we're not trying to limit when a parent can take parental leave, but we want to prioritise at the same time the first year of a child's life that the leave would be extended to cover that first year. But other areas of leave cover other options as well. In terms of the increasing percentage of the GDP, I should say that the First 5, which is the government programme on early childcare and learning, has already committed to doubling from the 0.37 of GDP. They've already committed to doubling that by 2028. So we were looking to get to the full 1% by, and the new wording would be by the latest of 2030. So we're pushing them, but they are already making commitments in that vein. So we thought that in that sense we didn't need a shorter and longer term, because the government is already committed for 2028. So that's the way we looked at that.
And have you covered the lone parent point?
Yeah, the lone parent, we did envisage a lone parent having a year's leave in the first year of their child's life. That's what we envisaged. And again, that came up in both the submissions, but in the presentations in the care section earlier on.
Mm-hmm. And on the question of, I think it was Noreen Hayes who talked about the over-regulation of the private sector childcare. I think by the wording that we have here, what we are intending, if it's publicly funded and regulated, that there would be one regulatory model, whether it's public or private. So I think that would take care of that point that she raised.
Yes. Yes.
Okay. So there were one or two nuances there, but let me try out on you, because we're trying to find the best way all the time to reflect your views. What I was doing in the last few minutes was trying to look at a revised wording for question 5. And what I have broken it down into is 5A and 5B. So Lena, could you put up the slide for question 5A, please? Okay, so you can see on the top the wording that you have been working on, and then you can see on the question, we're under the heading of revised, that we would propose to add the word accessible. Now, some people said over the next decade, maybe that's too long, but given that Ireland has the most private sector childcare in the EU, as far as I remember from the charts that we saw, I think it's not realistic to think that we would complete that move in 9 years. So I would propose not to change it, because I think we want to make ambitious but also practical recommendations as to what can actually be achieved by the state. And it will be a massive move to go from where we are today to what we are recommending. So, and then Lena, would you put up 5B, please, just so that we can see it? I'll poll you individually on 5A and 5B, but I just wanted you to see the two together. Sorry, I'm told that the wrong slide was put up. That's not helpful, but accidents do happen when you're trying to work under pressure. And I think, Jerry, have you pointed that out? Yes, you're right. This is what I meant by bearing with us. It's quite difficult to do these things in real time, but we'll get there if you bear with us. So this is B. I hope this is right. Here we propose 2 changes. So we would put into at least 1% and then by no later than 2030. So we'll go back in a moment to the correct version of 5A, the original and the revised. Okay, so I think we have the correct version now of 5A. So the proposal would be to add the word accessible, publicly funded, accessible, and regulated model of childcare. So what I'm going to ask you now is to we'll put this up in the form of a poll. Could you put that up now, please, Darren? And so here I'm asking you, do you prefer the original version or do you prefer the revised version? And we will go with the majority view, whichever is the preference of both of you. I hope in the light of the explanations that those changes would reflect the mood of the Assembly sufficiently, but let's check it and see. So if you can now click either for your choice, which is either the original text of 5A or the revised text of 5A, and then we will draw the conclusions from the result of the poll. So again, be sure that you're clicking the right one and then press submit, please. Okay, thanks very much. We have the result now. So Darren, can you put the result up? So we have 25% in favour of the original text and 75% in favour of the revised text. So that's a very clear outcome. And we actually have 91 people voting now. There was one person who was in and out because of technical problems, but who has now joined us. So just to explain why we have 91 people voting when we had 90 on the previous ones. So in terms of numbers of people, that's 23 for the original and 68 for the revised. So that is very clear. We'll come to 5B now, please. Here you're seeing it again now, just so that you know. The changes are to, in 5B, to add the words at least 1% by no later than 2030. So to increase the level of ambition. And can we show the poll for that now, please, Darren? Thank you. We have 90 answers, but we have 91 people. So I'm just waiting a few more seconds for the last person if they want to vote or not. Last one come in? No. Okay, well then we'll go with the result of the 90 votes. So Darren, can you show us that, please? So more or less the same again, 24% for the original text, 76 for the revised text. That's 22 people for the original text and 68 for the revised text. So clear majority there. Okay, that's excellent. So they will go on the ballot paper now. And now we move to question 6. Here we will take 6A and 6B separately. We didn't get, we got questions about question 6, but we didn't get any draft suggestions for revised wording. So we'll put the slides for 6A first, please. Lena, if you can put that up. Paid leave for parents should cover the first year of a child's life. And Darren, can we have the poll, please? Okay, so straightforward, yes or no. Again, make sure before you press submit. Okay, so we have 91 votes registered on this. Darren, can you show us the results, please? 82 and 9. Okay, so 90% in favor of 6A and 10% against. That's 82 people in favor and 9 against. Thank you. And then we come to 6B. Thank you, Lena. So this reads, paid leave for parents should be non-transferable to encourage sharing of childcare responsibility between parents. Okay, Darren, can you put up the poll, please? Okay. Again, we'll take your views on this. And again, be careful before you press submit. Okay, so we're at 88 people voting. We just need the last one or two. See, somebody wants us to have a 20-second timer, but I think that's a little bit too rushed. Okay, so now we have 90 people have voted, so we'll close the poll at that. Darren, can we see the results, please? 66, 24, okay. So on this one, we have a more nuanced outcome. We have 73% in favor, 27 against. That means 66 people voted in favor and 24 against. Then we move to 6C and D that we're going to take together. So do you agree that paid leave for parents should provide lone parents with the same total leave period as a couple and be incentivized by increasing payment levels to encourage increased take-up? And then we'll go to the poll, please, Darren. So here you're voting on two separate recommendations. Okay, I think we'll go ahead with the results of 89 votes on this. Darren, can you put up the results, please? Okay, so we have 81% in favour of 6C and 19% against. That's 72 in favour and 17 against. Sorry, 72, 17. And on question 6D, 79% in favour of it being on the ballot paper, 21% against, and that's 70 people in favour and 19 against. Okay, thank you very much. Now, you'll have noticed that we're a little bit behind where we had perhaps optimistically thought we might be, but I think it's important that we take the time that's necessary to get this as right as we possibly can. So we're going to put you back in the breakout groups now for 15 minutes to discuss the last three questions, which are number 7, 8, and 9. And again, I think if you want to propose changes in the wording, please be as explicit as possible and email them to us. And if you have questions, do the same, and then we'll do the same next time around. We'll poll you on whether you want to revise the wording or not in the light of what's come from the groups, and we'll try to answer the questions to the very best of our ability. So we'll see you again in 15 minutes, which will be at 4:05. Thanks. This time we have a couple of wording revisions proposed, which I'll run through in a moment. And we also have some questions. So I'm going to take the questions first. There was a question about whether we should talk about index linking the home care budget in question 8B rather than putting in what we have in the current wording, which is increasing. So Emer, I'm going to ask you to reply to that question, please, and explain the difference between index linking and increasing.
Yes, we had gone for increasing because in a way it's a higher bar. Because if you look at the later half of the sentence, it talks about growing demand, but also reducing waiting lists. So index linking on its own is unlikely to be sufficient to address that. So we would need a kind of a boost in overall spend. And just there was another query on whether we should say reduce waiting lists and waiting times. But in fact, they're enmeshed so that if you reduce waiting lists, anyone on that list will have a reduced time for service. So for that reason, we're not proposing changing 8B.
Thank you very much. And Ursula, can I ask you to reply to the questions? What does person-centred financial support mean in 7B? And what does home care packages mean in 8A?
Yeah, they're actually linked together, but person-centred, in the first instance, it's the care recipient would get the financial support, and they would be able to choose the kind of care supports that they then want to engage with. But it's also based on assessment of needs. So there's a principle that the health service would engage in an assessment of individual needs and provide support in a way that's most flexible for the care recipient to use in the way they see fit. In terms of home care packages, that's a package of whether you get occupational therapy supports, which are maybe supports for equipment that make it easier to live at home in adapted living situations, or whether you get home care personal assistance hours. So packages can be designed to fit the individual older person or person with the disabilities. And it covers both equipment and person hours. It might be you need 24-hour care. It might be you need just a couple of hours a day. And so all of that's assessed and it's converted into a home care package for each individual.
Okay, and Ursula, there's one other question I forgot. What statutory, regarding 8A, what statutory rights currently exist, please?
Yeah, this is very important because at the moment we have a statutory right to nursing care. Well, we don't have a statutory right for home care, although that's been promised in new legislation. So we want to encourage that. And the thing about it is, even though we have a statutory right to nursing care, there's a shortage of spaces. So there's still a limitation on what's available. But it's important at the same time to establish the right to both home care and nursing care, which this amendment is intended to do.
Okay. And on the question of whether we say increase or index link, I see something going on in the chat line. The group which suggested it had suggested both increasing and index linking, but I have the same reaction as Mary Claire in the chat. Emer, is that to some extent contradictory from what you explained?
Well, I think that there is a risk that if given the option that the political will might be to index link, which at the moment would result in a very, very small increase and certainly wouldn't be sufficient to meet growing demand and reduce waiting lists. So it could cause confusion and perhaps be a hostage to fortune.
Might produce the wrong result compared to what citizens are trying to achieve. Okay, so I'm going to just tell you where we would propose to take the suggested wording on board. I'm then going to go to the facilitators to ask them if there's anything that's not covered by the answers we've given and by the wording changes that we propose that the groups want to raise, and then we'll come to the wording. So what I would propose to take out of what you've sent us is in 7C, that we would keep the text as it is, be enabled to participate as fully as possible in decisions on their care needs, and then add, based on principles of fairness, respect, equality, and dignity. And in 7D, which currently reads, be facilitated if their choice is to be cared for at home, change it to saying be facilitated as much as possible if their choice is to be cared for at home. Now, we'll come back to putting that up on the screen for you in a moment when we're asking you to choose, but I just want to hear from the facilitators whether there is anything else that I haven't mentioned or that we haven't clarified that was raised in the groups. So I'll go in the opposite order this time round. Can I come to group 9 first, please?
Thank you, Chair. Ursula has clarified most of what the members in room 9. Just there was one on question 7D, care for older persons and persons with disabilities should be facilitated if their choice is to be cared for at home. The suggestion amongst the members was that that should be extended to say should be facilitated and resourced if their choice is to be cared from home.
We have incorporated that.
Sorry, yes, I think I didn't read that out, but we're proposing to take that on board as well, so that would take care of that. Thank you.
Just on the point on 8B, the thought process behind having index linking and increasing in the same was that index linking would at least give a protection or a benchmark position that.
Well, actually, at the moment, it would go negative. It would mean a reduction because we have the consumer price index is falling, and I don't think that's what anybody means to achieve. I think the word increase is better for that reason.
Thank you. Yeah. That's all from
okay, thank you very much. Group 8, please.
Room 8, good afternoon, Chair. No, the 3 points that you've raised were points from our room. The wording for 7D, they had be facilitated if their choice is to be cared for at home as far as practical. So as much as possible, it's the same thing. So well, yeah. No, that's everything from me. Thank you, Chair.
Thank you very much. Group 7. Hello, Group 7, are you there? I'll come back to Group 7 in a minute. Yes. Group 6. Sorry, Group 7, you're with us now. Okay, so please.
Sorry, Chair. Technical issues. Yeah, I think everybody was happy with the contents of the questions. There was one slight comment in relation to one of the questions, and that is that accessibility in the home should also be supported. But I think it was acknowledged that there is some kind of a provision for that already in there.
Yeah, I think so. Okay, thanks very much. Group 7, Group 6.
Thank you, Chair. So again, I think you've already answered this 7D. They wanted to add in at the home. We asked for clarification on it and the question's been sent, but we also wanted to add in where possible and if practical, just to the end of that sentence. And under 9, at the end of the sentence where it says reapply for support, take out the wording when a person turns 18 and put in regardless of age. And that's us. Thank you very much.
Okay, well, I think the wording that we're going to propose as much as possible covers that requirement.
Yeah, thank you.
I have to say, I don't really see the difference between when the significance is when a person turns 18, that's when all the services in the state change, regardless of age is slightly different. And I think the point we're trying to get at is when you move from being considered to be a child to being an adult, that is the moment when everything falls apart and you have to reapply all the time. So I think we should stick to that. That was the pitch made very passionately by the father of the two adult girls that he has to look after, if you remember back to that.
Okay, I think it's where the group or where my room were talking about was that when a person turns 65, when they come to pensionable age, that they go into older person services, and just maybe to keep it fairly seamless. And that's why they didn't want a particular age number to be put in there, but they were very mindful of that when somebody turns 18, that they continue it goes through. So that's where that came from.
I think in terms of conveying a clear message back to the powers that be, it's important to highlight this gulf that seems to open up at age 18.
Okay, thank you.
Thank you. Group 5, please.
Yeah, thank you. Chair, Group 5, we're happy with the questions. We did have some discussion around the same points as the other tables, but felt that the words "as fully as possible" in Part C kind of dealt with any uncertainty that might exist around Part D. But we were happy with the group was happy with the questions as framed.
Thank you very much. Group 4, please.
Catherine. Yes, in Group 4, the citizens there were happy with the questions. There was just clarification sought around the word facilitated in 7D. It was more a confirmation that it did include, say, an independent advocate, and to make sure that it is people or person focused, maybe non-verbal disabilities and older persons.
Yep. Thank you very much. Group 3, please.
Yes, the citizens in Group 3 were happy with question 7 and 9. In respect to question 8, this is on the assumption that the means testing currently in place would remain in place. And also in question 8B, a question arose as to why the time limit, and they believe this was 2030, was removed from a previous version of this question. This is a question to the Secretariat.
This was in relation to 8B home care.
Yes.
I wonder if there's a confusion between that and the previous. We'll try and get an answer on the chat line to that. Group 2, please.
Thanks, Chair. One question under 7D was in terms of if there would be any limitations regarding facilitation of an individual care at home. So that was a question. And in relation to suggestions in terms of wording, one of the citizens made a suggestion in terms of, instead of the use of older people, the use of the word seniors. Then at 7A, to add at the end of that, based on regular ongoing review. The point that was being made was that review care wouldn't be based on a moment in time, but be ongoing. After 8A, the inclusion of provide a statutory right for, and then timely approval and payment for home care packages as well as nursing homes. And then an additional Part C under 8A, which the suggestion being C being improved coordination between state agencies and should be seamless. Improved coordination between state agencies and should be seamless. So those were the four suggested changes from the citizens, from some or all citizens at Group 2.
Thank you very much. I think we've clarified back to you that the term older persons is what's widely used in legislation and internationally. So I think we'll stick with the widely used term. The other point seemed to me to be descriptive, and I can understand the sense behind them, but I think now we're getting into too much prescription in the recommendation, I would say. But we have to find a balance between having a clear recommendation and writing in so many sub-clauses that the punch of the message gets lost. And I think we're taking up the main part of that in the changes that we're proposing. At least I hope so. So Group 1, please, is my last on my list.
Thank you, Chair. The citizens in Room 1 were broadly happy with the wording, subject to the two changes that you mentioned in respect of 7C and 7D.
Okay. Right. So was there one question there that came up? No, I think we've dealt with all the questions now, haven't we? On the 2030, yes, the only reference in the previous recommendations 2030 was in relation to childcare. We didn't have it in this set of questions, so it hasn't disappeared for any strange reason. Okay, so let's now go through questions 7, 8, and 9. For question 7, A and B, we are not proposing to make any changes. So let's put the questions up on the screen, please, Lena. Okay, so these are the questions that we're going to poll you on now. They are not changed from what you have already seen because we didn't think we've explained person-centered, and that was the only question that came up here. So can we move to the poll now, please, Darren? Okay, so can you now say yes or no to having question 7A and 7B on the ballot paper in April, please? And again, take your time, but not too much time, and be sure what you're voting before you press submit. So we have 87 people have voted. I think we have 1 or 2 people have had to leave us given the overrun, which is understandable. I'll just wait a few seconds longer if there's somebody else to vote, but let's see. Are we still at 87? 89? Okay, so we'll close the vote now on 89. And Darren, will you show us the replies, please? Okay, that's fairly convincing. 98% for 7A, which would be 87 people in favour, 2 against. And for 7B, we have 94% in favour, 6% against, and that translates as 84 people in favour and 5 against. Okay, so now we're going to come to, are we doing 7C and D separately? Yes. Okay, so let's have 7D on the screen, please, Lena. Sorry, 7C, what am I saying? I'm getting lost in the 7Cs. Okay, so here you can see the changed wording. In C, we're proposing to add the words based on principles of fairness, respect, equality, and dignity. Okay, so can we now come to the poll, please, Darren? Okay, so here, as before, you have the choice between the revised wording and the original text. Please vote yes, sorry, please vote one of them. Do you prefer the original text or the revised text? And again, think carefully before you press submit. Okay, so we're going to close the vote with 88. Darren, can you show us the results? Okay, so that's very clear. 19% for the original text, 81% for the revised text. That's 17 people for the original text and 71 for the revised one. And then we'll come to the wording of 7D, please, Lena. And here we have 2 changes to the original text. So we would now add in the revised text be facilitated, and the new words would be and resourced as much as possible if their choice is to be cared for at home. So Darren, can we go to the poll, please? So same format again. Do you prefer the original text or the revised text? Okay, we're up to 88 again. If there are any last votes to come in, please make them now. Yeah. Okay, I think we'll close the poll on 88. So here we have original text 25%, revised text 75%, and that's 22 people for the original text and 66 for the revised. So again, a clear result. Now, Lena, we'll come to question 8, please. So here, for the reasons that we explained about not changing the word increasing because we have a hope of getting it increased, that indexing would actually currently mean a reduction, we're proposing to leave the original text as it is. So can we please come to the poll now, Darren? Okay, so here we're asking you to vote together on 8A and 8B. Again, be careful which box you click and then press submit, please. Okay, we have 85 replies in at the moment. So if there's a few people still making up their minds, you have a little bit of limited time to complete the vote, please. Okay, we have 86 votes in, so I think we'll close the poll on that because I'm not sure how many people have had to leave us. So Darren, can you show us the results, please? Oh, well, that's very clear. We have 100% for 8A, which is obviously 86 people. And we have 98% for B, which is 84 people and 2 against. So that's fine. Yes, I see Liam O'Reilly saying our first landslide. Okay, that's a historic moment. And now we come to question 9, please, Lena, if we could have that. Okay, so this one is not changed either. Can I ask you whether you agree or disagree that this question should go on the ballot paper in April? So Darren, can we have the poll, please? Okay, we have 87 votes in. I think we will close the poll at that. Do you agree, question 9 on the ballot paper, 97% in favour, 3 against? That means 84 in favour and 3 against. Now, you might think you're finished voting now, but we have one more vote to take. I think that, again, we found the right way to work together and to be able to take your input on board and to hopefully answer the questions that you have. So I would like, because the ownership is so important for all of this, to be really the valid view of the citizens. I'd like to come back to the start of the afternoon, and I'm going to I'm going to take a poll now on whether you want to revisit the wording of questions 1 to 4, or whether overall you're happy with the outcome as you have already indicated earlier today. So Lena, could you put the slide up, please? I think this is the only way of doing it, is to test the mood of the assembly each time and then to go with the majority. So if we could find the slide, we will put it up on the screen. Okay, so the question that we would ask you, I think this is the clearest way of phrasing it. Do you want to return to the wording of questions 1 to 4 at our next meeting? Or do you want today's agreed wording to go on the ballot paper? So you'll have a choice of clicking between return to the wording at the next meeting or today's agreed wording for the ballot paper. And Darren, can you put the poll up now, please? Okay, so here you have a choice of come back to the next meeting to look at questions 1 to 4 again, or go ahead with what was agreed today. So take your time, think about it, and then click one or the other and then press submit, please. Okay, so we're going to close the poll on the basis of 86 responses. Darren, can you show us the results, please? Okay, so return to wording at the next meeting, 35%. Stick with what we agreed today, 65%, and that is 30 people want to go back, but 56 want to go ahead. So I think we have to follow the majority, and we will consider the wording of the ballot papers 1 to 4 now closed. So if you can bear with me for just a few more minutes, I have a couple of other announcements to make. First of all, let me thank you all for another excellent day's work. We now have 2 sets of ballot papers ready for voting on in April, the one on the Constitution and the one on care. You could see today that it is going to be a little bit more complicated and time consuming because we need to go from breakout groups into plenary, look at revised wording, and go back again. But I think now that we have found a good way to work, and we're already working on preparing the draft ballot papers for the next time that we meet on the 17th and 18th of April. Now, there's a lot to go through, so we've decided to break them into two bits of work. First of all, we will send you some recommendations, draft recommendations on the topics of leadership, gender norms and stereotypes, and then some cross-cutting recommendations on equality. That would be one block of work. And then the second block of work would deal with work, social protection and gender-based violence. So you'll be getting two packages from us. Our plan is to send you the first draft ballot paper for your feedback on the 19th of March, so following St. Patrick's Day, and we'll give you a deadline to get back to us with your comments and suggestions by the 23rd of March. You don't need to write all this down, we'll send it to you in writing. And again, can I encourage the maximum number of replies like last time? It really does help to get the recommendations into reasonably good shape for our final meetings, the more that you contribute to the discussion. Then the second ballot paper you would get on the 26th of March with a deadline of the 30th of March, and both times we'll be using SurveyMonkey to get your comments on that. So when we get your comments back, we will revise both sets of ballot papers on the basis of your replies, and then we'll send them back to you for the 11th of April. And that means that you would have 1 week before we meet again on the 17th and 18th of April. Now, I know this might seem like a lot of extra work, but it really is the final push as we're getting very close to the end of the process now. And we won't be sending you any new presentations by video, but we will be sending you a couple more videos. One will be on the voting system. I'm very pleased to say now that we have identified a sound, high quality e-voting system. So you will not be voting by Zoom, you will be voting by a much more secure system. And we will be sending you a video presentation on that. And we'll also organize a trial run so that you feel comfortable with how you're actually going to vote when the time comes. And we'll send you the details on that very shortly. The other video is that I will do like last time. I will, when we have revised the ballot papers, I will do a ballot paper to explain how we have changed them from the drafts you will have received and why, and particularly why we have taken some comments on board and maybe why we haven't taken some others on board. So finally, I want to just end this session today and apologize for the fact that it went on a bit longer, but I think it was a productive use of the extra time. And we have, I'm glad to say that most of you have stuck with it, and I really appreciate that. I want to thank you for your continued commitment and all the hard work, time and energy that you're putting into this process. It may be hard to believe, but we're nearly there. We're nearly at the finishing line. One last push and on the 17th and 18th of April, and we'll be there. And I think we are not only getting there, but also agreeing very good recommendations that I hope will be widely taken up. And again, the closing ceremony that we're proposing now to have, I think would give more impact to our recommendations than if we're going to be announcing them on a Sunday afternoon. So it only remains for me to thank you all very much for the time and effort you're putting into it, for sticking with us today, for helping us to find the right way forward. And I'd like to wish you all a very happy St. Patrick's Day, and we'll see you again on the 17th and 18th of April. Have a good rest of the weekend, and we'll be in touch electronically and by video, and we'll see you again in a month's time. Thank you all so much.
Thank you very much.
Bye-bye.
Bye.